Are you experiencing pain on the top of your foot? It might be because the tendons there are inflamed. If so, then you have a condition called extensor tendonitis. These tendons, known as the extensor tendons, are connected to your toes and play an important role in foot movement. Every time you walk, run, or jump, the extensor tendons help lift the front of your foot and allow you to move your toes. Unlike other areas of the foot, the skin over the extensor tendons is quite thin and lacks protective cushioning of the muscles or fatty tissue. This lack of protection makes the tendons more prone to irritation, strain, and injury, particularly during activities that place extra stress on the top of the foot. Today I'll be talking about what causes extensor tendonitis, its symptoms, treatment, and prevention. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. If you find this information helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. You're probably wondering what causes extensor tendonitis. It usually develops due to repeated stress or pressure on the tendons at the top of the foot or overuse of those tendons. Unlike acute injuries that happen suddenly, extensor tendonitis often develops gradually. It's common for pain to start mildly and get worse over time, particularly with ongoing activity. Various factors can increase the risk of developing this condition. First is spending long hours on your feet without wearing supportive shoes. This may be your situation if you have a job that requires that. Athletes are also more prone to developing it as repetitive motion can strain the extensor tendons. Runners, dancers, skiers, basketball players, or anyone who enjoys high-impact sports. Wearing shoes that are too tight can also cause the problem. Tight shoes compress the top of the foot and irritate the tendons. Running on inclined surfaces, up or downhill, is also known to increase the likelihood of this extensor tendon strain. This can occur when you run the hills around town or increase the incline too much on a treadmill. Tight calf muscles can also add to the stress of tendons and cause an increased risk of developing this tendonitis, because if you're tight in the back and you try to move forward, you're going to have to lift the foot more and overuse those tendons. People with flat feet or high arches are also at greater risk. Finally, certain health conditions such as rheumatoid arthritis and osteoarthritis can put you at higher risk. Now let's talk about the symptoms of extensor tendonitis. In addition to pain at the top of the foot, you may also notice redness, warmth, and swelling over the extensor tendons. You may also experience stiffness, which can make it difficult to move your toes. As you pull your toes upward, you may develop pain in the ball of your foot as well. Numbness or tingling can also occur, particularly when shoes rub constantly over the top of the foot on the tendons and the nerves in this area. You may notice a crunching sensation called crepitus when pressing on the tendon. These symptoms can worsen with continued use of the foot and may persist if not treated. To diagnose extensor tendonitis, we'll examine your foot and look for the signs of tendon inflammation, such as redness, tenderness, and swelling, or numbness when we tap the foot in the area of the irritated tendon. To rule out other causes of pain, like stress fractures, we'll order an X-ray and sometimes an MRI to determine the extent of the problem. To treat extensor tendonitis initially, we'll focus on reducing your inflammation and pain. Most cases take around 2 to 4 weeks to heal, but recovery times can vary depending upon the severity of the condition. If you have the pain in the ball of the foot, this will need to be addressed separately. You can begin treatment at home by using the RICE protocol. Rest and elevate your foot as much as possible to reduce strain on the tendons. Ice 20 minutes several times a day. ACE wrap bandage can help compress it and reduce swelling. Use an over-the-counter anti-inflammatory medication if your doctor approves it. At the office, we offer the following treatment: MLS laser therapy. This laser treats both pain and inflammation and heals the tendon at a deeper cellular level. I'll put a link to more information about this treatment above. If your poor foot mechanics are contributing to tendonitis, we'll cast you to have custom orthotics made. They can help take pressure off the tendons by properly aligning your foot. And because calf tightness can also affect your extensor tendons, I'll recommend stretching with an Achilles splint to relieve the tension that can make your symptoms worse. I'll put a link above to a video describing how to use this. It's also important to wear good shoes with support and athletic shoes that are designed for the sport you engage in to help in your recovery. If you're irritated on the tendons and developing numbness, there's a relacing technique very specific for high arches that is described in an additional video. Finally, I may refer you for physical therapy to strengthen and support the affected tendons. There are several steps you can take to reduce the chance of it recurring. Start by ensuring you're wearing properly fitted footwear. It's important to have your feet measured each time you buy new shoes, as poorly fitting shoes can lead to increased strain or compression on the extensor tendon. Replace athletic shoes every 500 miles or as soon as you notice signs of wear. If you tend to run up or down hills or use an incline on the treadmill, limit these activities as much as possible. Be sure to wear your custom orthotics all the time if you have them, since foot imbalances can be a cause of this condition. Do an adequate warm-up and cool-down before any physical activity such as dynamic stretching. I'll put a link to some dynamic stretches above. Strengthening exercises for the top of the foot, as well as regular stretching of the calf muscles, can provide support to the tendons and make them more resilient to injury or less prone to developing it in the first place. By understanding the causes, symptoms, and preventive steps, you can manage extensor tendonitis effectively and take steps to keep your feet healthy, pain-free, and keep you doing the activities you love. Again, if you'd like to receive a notification every time I release a new foot health video, please remember to subscribe, like, and hit the bell.